If you're worried about someone's mental health and you're not sure where to start, you're in the right place. My name is Kat Nichols and I'm a content creator at Happyful, and I'm joined today by counsellor Laura Duester to talk more about what to do if you're worried about someone's mental health. So to kick us off, Laura, could you tell us a little bit more about yourself and the work that you do?
Yes, of course. Hi. So my name is Laura Deuster and I work as a counsellor and psychotherapist. I'm based in Bicester in North Oxfordshire, and I work one-to-one with individuals from age 16 upwards, talking about all kinds of mental health difficulties. And I also work with groups.
Oh, amazing. So something that can come up for a lot of people when we're supporting other people or worried about someone is how to tell if they might be struggling. So I was interested if you could share any potential signs that somebody might be going through a tough time with their mental health.
So this is a really difficult question to answer, actually, because it's so personal and there are so many different signs that someone might show. So there's not a kind of one size fits all type of model with this kind of thing. So usually with mental health problems, there tends to be ongoing difficulties in terms of mood, behaviour or functioning, or all of those. So you might see someone behaving differently. So for example, they might be drinking a lot or using drugs. You might notice that they're losing a lot of weight or gaining a lot of weight. They might be looking really tired. Maybe they're withdrawing socially and avoiding going out. You might see signs of self-harm. So you might see kind of cuts or burns, that kind of thing. They might also tell you in terms of their mood, how they're feeling. There can be things, so if you notice they're saying, I've got a lot of worries, or they're feeling really down. Maybe they're having delusions. You might also notice if they're really angry or irritable. That can be another really, a really important sign that often gets missed. Or if they mention anything like feeling like there's no way out, feeling helpless, anything that might be perhaps suicidal, or feeling really worthless. I think it can be all kinds of things like that. Is what also happens sometimes, which is really difficult, is that people will just say they're absolutely fine and they will shut down the conversation. And so I notice very often, noticing that someone's saying fine but they don't look fine is often an indication that something's difficult, where it feels like they're saying I'm fine, not because they are, but because they're trying to avoid having a conversation. That can be a real telltale sign. And sometimes as well, people will present with physical symptoms. So they might say, do you know, I'm having so many headaches, or, oh, my body feels really achy, or I've just got constant stomach pain. And sometimes that's, again, a way of avoiding how it feels emotionally. It kind of gets expressed through the body. So again, that might be something else that you notice. It is a bit of a minefield. So I want to reassure people that there isn't like this sort of checklist that you can notice, but it's, you know, where things are different for somebody, different to usual, and there might be something worrying. It's about opening up that conversation to try and find out more and showing that you're there. And you can also, I'm saying a lot here, you
It's good.
can also be aware there are some kind of common triggers that often will lead to mental health difficulties. So being aware, for example, if someone's had a bereavement, if they've lost their job, if they've got financial difficulties, if they're going through a divorce or relationship or family problems, if they've got a physical illness, or they're having stress at work or at college or school, all of those kind of things, we know they often match with mental health difficulties. So it's worth being aware if you kind of know someone's going through that kind of thing, maybe being a bit more mindful of what might be going on for them, and if there are differences in their behaviour or mood or the way they're engaging.
Yeah, and I think that's what it comes down to, isn't it? It's noticing differences. Something isn't quite the norm with them. And I thought it was a really great point what you said about the physical symptoms, because I think sometimes we can experience that and not realize that there's something else going on underneath. Like I've experienced anxiety and I've definitely had it present as physical symptoms before I even caught on what was really going on. So that's a really good point for people to remember, I think.
Yeah, it's worth saying actually anxiety is one of the really common ones that often presents as physical symptoms, particularly if people have panic, that they can often feel like they can't breathe, or the chest is closing up. Sometimes people think they're having a heart attack, and often they will only realise it's anxiety after they've been medically checked out. So again, that can be something to look out for, but you know, you've got to be so careful. If it was a heart attack, you wouldn't want to avoid getting help. So I think for people to be aware, when you're not the expert, you're not a medical professional, I'm not a medical professional, and it's really important to get, if there are physical things, get them checked out. And then if it's not something physically, see what might be going on emotionally, because we do hold a lot of tension in our bodies.
Yeah, definitely, definitely. So if we have perhaps recognized some of these signs in someone and we are worried about them, do you have any advice for how we can start to open up that conversation with them about mental health?
Yeah. So I've got a few tips. I think my number one tip, though, I think which sort of goes over everything, is to be there and be persistent about it. People will not always, in fact, often they won't want to open up straight away. It can take a huge amount of courage. You can feel so vulnerable to open up about your mental health. So just because you ask someone once or twice, or even sometimes 10 times and they don't reply, if you think something's off, you think they might need some support, keep being there and keep being open to that conversation. So that kind of persistence and being there is probably my number one tip. But in terms of having a conversation, asking how the person is, so asking how they are, and expressing that you want them to be open and honest. You're a mental health advocate. It's okay for them to say they're not fine. So showing that you actually want to hear the truth and you don't want to just be told, oh, fine, everything's okay.
Mm.
Showing that that's all right. You recognise they might be having a hard time and you're open to a conversation about that. Another key thing is giving your full attention. So really making eye contact. One of the things we so often do when we meet with our friends and family, we have our phone sitting on the table. So putting it on silent, turning it over so you can't see when notifications come up, showing that you really care and you're giving this person your full attention. Even if they don't want to speak, that can speak volumes about not feeling alone and feeling like they're being heard. You can use open questions, is really helpful. So rather than asking closed questions, which is where it's a yes and no answer, an open question is kind of encourages somebody to speak a bit more widely and say more. So you can say things like, what's been bothering you most? Or can you tell me more about that? That kind of thing that would encourage someone to speak a bit more. And then also asking people what they need. So saying, how can I support you? Even small acts of kindness, like just texting someone saying, I'm thinking about you. I know you don't want to talk, but I'm thinking about you, can be huge. And often because we want to help, we can have this idea like helping will be getting them to therapy, speaking to the GP, and all of these kind of things, which probably would be helpful, but they may or may not be ready for those things. So asking the person, what do you need? How can I support you? And that could be helping with the washing up, or it could be having a movie night with them where you don't talk about mental health at all and you just, have a sort of switch off and have a bit of fun. Or it could be looking after the kids for the night so that they get a bit of break from what's causing them stress. I mean, it could look so different for different people, but offering that support and asking them what they need, what help they want, is really, really useful. So trying not to be judgmental, not putting your own advice or your own decision making onto it, allowing the person to say what they need.
Yeah, those are really, really great points. And yeah, I think just as you said, being there is the most important thing, being there and listening non-judgmentally, and just, yeah, asking what you need is such a small thing, but it makes a real difference, to give them that kind of agency over what can be supportive. And if somebody perhaps is really struggling and we think they could do with some professional support, what is the best way? How can we support them in getting that help that they need without obviously crossing any boundaries or pushing them too far?
Yeah, so I mean, the important thing is if someone is in crisis where they need immediate help,
Mm.
then ideally with their consent, but I guess sometimes it might be really necessary to do this without consent. You might have to call 999, or if it's less urgent, 111 would be your other option, or Samaritans, or somewhere else, or their GP.
Mm.
Ideally, like I said, with their consent, trying to get that emergency support if that's what they need. Where it's not so urgent, I think you can say things like, "I'm always here if you need to talk. I'm here anytime you want. I'm patient. I'm as patient as you need." That kind of thing. So they know that you're there, and you're not trying to fob them off. It's not a rejection.
Yeah.
And then you might also say things like, "I wonder if you'd consider speaking to a professional," or "I wonder if there might be some support we could get you with this." So it's kind of posing it as an invitation rather than a direction. if that makes
Mm.
sense. And opening the possibility that maybe some professional support or assistance could be really useful. And we don't want to hog the conversation because it's important to be open and listening. But sometimes if you've had your own mental health difficulties or you've seen a therapist, spoken to a GP, it can be really helpful to say, oh, I spoke to them and it was really helpful. Just to kind of give that validation that it's okay to do that we're allowed to get help and support. Again, you can ask if they need any help or support with that. So sometimes I've had clients come to me where they've had a friend who's made a short list of counsellors for them in their local area, and then they choose which one they like the look of out of the top 3 or 4. And that can be really helpful because it's very daunting sometimes looking for a therapist because there are so many out there and we've all got different approaches. So that can be helpful practically, but some people might not like that. So it's about asking what kind of support they need, and if you can provide resources like helplines, websites, things like Samaritans, Childline, Mind is a great one. For LGBTQ issues, there are lots of charities and websites related to that. Anxiety's got Anxiety UK. There's loads of different websites and helplines that you might suggest to them. I think giving them the resources and showing them all the possibilities is really useful.
Yeah, exactly. And not kind of telling them what to do, but offering this up as their options. Yeah, I really like that. And I really like the practical support. I've actually done that because I work for Happy Full and I know counselling directory very well. My friends and family know that I'm in quite a good position to like have a little look through. And it is quite daunting when you look on, especially on our directory, we have thousands of counsellors on there. It can be overwhelming. So to have somebody offer to say, hey, do you want me to like have a little look and see if there's anyone local that might be good for you? I've done that a few times, and even offering to go to the doctors with someone can be really helpful as well, I think, because it can be quite a daunting task to do that by yourself.
Yeah, absolutely. Supporting people to go to appointments, medical appointments particularly, can be really useful. What I come across actually in my personal life when friends and loved ones want therapy is often they want my advice about what type of therapy they should have. And actually, I don't think obviously I work in this area, but I don't think you need to be an expert to be able to help someone kind of work that out a little bit. So maybe it's worth thinking, if you've had your own therapy, you might know I did this type and that was useful for me. But there are kind of the 3 main types. It's sort of humanistic, which is person-centered, is more speaking and being heard. It's more about that kind of listening. It's very open. Then there's CBT, which is quite structured. The NHS tends to use that. It's often short term. It's very symptom focused. So some people like that approach because you get homework. It's very practical. You do these activities. And then the other approach is psychodynamic, which is my main approach, and that's looking more deeply. So if you've got ongoing problems that have repeatedly come up, or things from childhood or past experiences, maybe things unconsciously that you're not aware of, that would be looking at that kind of thing. So it can be, I know it's difficult when you're looking on counselling directory or somewhere to go, I don't know what type of approach I need. And maybe you're having a conversation, what type of support do you want? Do you want something more practical? Do you want to dig into your childhood? That might help you kind of work that out, and you could maybe do that with a friend or someone to help them navigate therapy.
Yeah, definitely. I love that. That's a really great point. So if we're talking to someone and we think that they could do with professional support, but we've offered this to them and they're not ready for that step yet, because obviously not everybody is ready for that. What would you suggest? What can we do in that situation, basically?
So I think I've kind of already said this about being persistent and being there. If someone doesn't want support, if they're not in emergency crisis, we can't do anything. It might make you feel really helpless, and I think we're going to talk a little bit about self-care in a moment. So we'll come back to that. So it can feel horrible, and you might feel really like you wish you could do something, but if someone's not ready, they're not ready. And just being there and showing them they're not alone, you're open to having that conversation, you're patient, you're there when they want you to support them, and you will offer any support that they need, whatever that looks like, whether that's a list of counsellors or whether that's going with them to an appointment or whether that's buying them a bar of chocolate if they're having a bad day. That's all you can do, is show that you're there. I suppose the other thing as well is to keep checking in. Keep asking how you are, even if you keep getting the same response, fine, or don't want to talk about it. Keep asking, keep opening the conversation.
Yeah, I think that's really good. And the reason I wanted to ask that question was to get that answer, really, that we can't do anything more. We can only do what we can do. And that's so important for people to realize. And yes, we're going to talk about self-care now, actually. So yeah, if we have got loved ones in our lives that are struggling, how can we ensure that we are looking after ourselves in the best possible way?
So there's a few really key things here. So first of all, this is the self-care kind of thing. It is emotionally and physically exhausting looking after somebody who and trying to support somebody that has mental health difficulties. So noticing that that is going to maybe take away some of your energy, it's going to be draining, and you need to do more to kind of fill up your own cup. So it's like a bit like a phone battery. That's going to be draining your battery more quickly than usual. So you're going to have to find more ways to charge up. So that can look, I mean, it can look like so many different things. So a kind of classic self-care is the bubble bath with candles, and that is lovely and works beautifully for some people. But it can be so many different things. So it can be going for a walk, it can be spending time with people you love, it can be making yourself a nice meal. I mean, it can be absolutely anything that works for you, that that feels like you're charging and you're kind of boosting your battery again. Also getting support from other people, so trying not to be alone in supporting someone where possible. So you might need your own support, you might want to speak to a therapist yourself or speak to your own friends and family about how you're feeling, perhaps if you're feeling helpless or frustrated or whatever you're feeling. It could be a whole load of feelings. And you might also want to get support from other friends and family to support the person. So if you can share it between you, that really helps. And then my third point is about boundaries. We're not the NHS. We're not a crisis service. And it is okay to say to someone, I can't answer the phone anytime you want. I will try to be there, but I can't answer it at this time because I'm at work or because I'm asleep or whatever it is. It's okay for you to set boundaries, because if you don't look after yourself, you can't support anyone else. And I've heard plenty of people that have come to therapy with me saying that they're exhausted and they're drained because they've spent so long looking after other people and not prioritizing themselves. So it's sort of counterproductive, actually. So setting boundaries is really important, making sure that you can manage yourself.
Yeah, it's a really great point, and one I think we all need to take on board is the boundaries piece, because it can be so easy to just want to help and also want to fix people in a way. I think that's another point that is worth mentioning, is I'm definitely a problem fixer. I definitely try to. I want to fix people's problems, but you can't always, and sometimes you have to accept that the person does not need fixing, and also that even if they do get the support that they need, this might be something they live with for a very long time, and it's not something necessarily that's going to be solved or something that you can help with. So yeah, that's just another thing that I just thought of. It's quite helpful for sure.
I think that's a good point.
Yeah. So thank you so much for your time today, Laura. Have you got anything else on this topic that you wanted to share with anyone about this topic of caring for someone who might be struggling?
I think the only thing I want to say is that if anyone who's watching this video is presumably trying to have some kind of conversation with someone who cares about it, and I just want to say thank you and praise yourself for trying to do that, because that kindness of just trying to think about someone, trying to support them, that can mean the world and make the world of difference, just knowing that you're there and that you're trying. So I think just thank you for trying to help people. We all need to be talking more about mental health.
So true. Thank you so much. And for anyone who wants to connect with you online, could you let people know where to find you?
Yep, so I've got my own practice called LD Therapy, and you can find that at ldtherapy.co.uk, and I'm also on the counselling directory.
Perfect, thank you. And yeah, if you're watching this and you're looking for more information about mental health, maybe the different types of therapies, and connecting with other counsellors, you can head to counselling-directory.org.uk. Thank you for watching.